Tonight, more monkeypox cases are popping up in Northeast Ohio. We're now up to 19 cases in Cleveland alone. And with so many questions coming into our newsroom, we want to be sure you know what matters most when it comes to keeping you and, of course, your family safe.
We have team coverage this evening with Monica Robbins tackling plans to ration vaccine doses, and Isabel Lawrence, who is learning more about the virus within the LGBTQ+ community. And that's where we begin tonight.
Isabel spoke with experts about the stigma surrounding it and what's being done to keep people safe.
They were just inundated with calls with people really concerned about monkeypox and really eager to get vaccinated.
The phones at the LGBT Community Center of Greater Cleveland have been ringing. Monkeypox, a virus spread by intimate close contact, is currently seen most in men who have sex with men. But Center Board member Kenyon Farrow knows this is a virus that can impact anyone.
There's no such thing as a gay disease. There's no such thing as a disease of senior citizens or of African Americans or other groups.
It's a message experts like Dr. Amy Edwards have been hitting home to stop the stigma.
Outbreaks don't stay in the first population. It was just luck. It has nothing to do with, lifestyle choices or any of that nonsense that I've heard people talk about.
Dr. Edwards says looking at the virus globally, the number of cases in men who have sex with men is already dropping as monkeypox moves into the wider population. Next come the vaccines.
The center is soon getting ready to, again, partner with Metro Health to make sure that people who come to the center can get vaccinated.
According to the Cuyahoga County Board of Health, the 1,200 vaccines they received from the federal government have been allocated to the board, Metro Health, the Cleveland Clinic, UH, and Central Outreach Wellness Center, all of whom serve the LGBTQ+ community.
I'm pretty confident by the end of this week, the doses should be in the hands of everyone who needs them in terms of the providers that we're engaging.
Now, I reached out to Central Outreach today. It's a wellness center that works with the LGBTQ+ community. They started administering the monkeypox vaccine yesterday at their Cleveland Heights location. They gave about 70 doses yesterday, and they also have an antiviral treatment. It's walk-in, no insurance needed. We have more information, including requirements to be eligible for the vaccine there on our website.
Those vaccines are starting to trickle in. Isabel, thank you.
And the limited supply of vaccine is likely not enough to stop the spread of monkeypox. Now the government is turning toward a form of vaccine rationing. To explain how this will work, let's continue our team coverage now with our senior health correspondent, Monica Robbins. Hi, Monica.
Hey, Russ. Yeah, the FDA issued an emergency use authorization that allows the monkeypox vaccine to be given in fractional doses. That would expand the supply fivefold. That means people will get a fifth of the full dose via intradermal administration, meaning putting the vaccine into rather than under the skin. The FDA is also allowing those under 18 who may be at risk for monkeypox to also be vaccinated. Now, a previous study showed this method can generate a strong immune response, but some experts are skeptical. This method has been used before in times of vaccine shortages. The monkeypox vaccine also requires 2 doses 28 days apart, so fractioning may help vaccinate more people, considering additional supply isn't expected until mid-next year, Russ.
Monica, let me ask you, where is the U.S. compared to the rest of the world in terms of cases?
As of now, we're leading the world with nearly 9,000 cases, including nearly 70 in Ohio. And according to the CDC, Wyoming is the only state so far without a case.
A question I'm sure you get a lot. Does the general public need to be concerned about this?
Yeah, I'm getting that routinely. Now, keep in mind, as Isabel said, while cases are mainly circulating among men who have sex with men, doesn't mean that it'll stay there, relating to the virus. But this is not COVID. It is not easily transmitted. It requires close, intimate skin contact or prolonged exposure to respiratory droplets. And the CDC says it may be possible to transmit via infected clothing, sheets, or towels, but more likely by touching infected skin. And it can take up to 3 weeks before symptoms to appear. And people are usually considered contagious once those lesions appear, and they remain contagious until the scabs have fallen off and new skin has formed, which takes about a month.
New information coming in every day on this, it appears.